Welcome back to What's Up on KWAT. Joining us on the phone on the What's Up program this morning is Sarah Taylor. Sarah, good morning to you.
Good morning. Thanks for having me.
You betcha. Good to talk with you, Sarah. You are speaking on behalf of a program that's being launched up at Prairie Lakes Hospital. First of all, before we get to that, tell us a little bit about Sarah Taylor, your background, and what you do.
Yeah, so I'm a registered nurse up here at Prairie Lakes Hospital. I've been working here in the OB department for about 14 years. I've been working in education and lactation support for the last at least 9 years now. So time flies when you're having fun, right?
Indeed, yeah. I wonder how many births you've been around, how many babies have been born over all of those years.
Quite a lot.
Quite a few.
I've lost track of that.
Yeah, for sure. Tell us what the Baby Café is.
Yeah, the Baby Cafe is something that we're really excited about. It's a free and informal breastfeeding support group that we're going to offer here up on our department. And we're going to have ongoing professional lactation care. And if you have any questions or concerns, it's a great thing to bring if you're coming for latching help or just want a baby weigh in or just want to share experiences with other moms. It's a great place to come and meet.
New to the Watertown area, why is this program important for folks here locally?
It's a very important program because it is going to help out all moms. You don't have to have an appointment time. You can just drop on in and get the support you need and have the company of other nursing moms as well. Hopefully we'll have some experienced moms and maybe we'll have some expecting moms just to get some information and education as they're trying to get started. But this is a nationwide nonprofit that we're teaming up with, the Baby Cafe USA. And so the nice part about it is, it's a network of licensed professionals. And we're trying to reduce health disparities and help moms reach their breastfeeding goals and their potential.
Sarah, what's the philosophy behind this national program?
As I mentioned, it's trying to reduce health disparities. So we're trying to make it an equal opportunity for everybody, trying to allow support for all people. So this is a completely free program. That's one of the great benefits of doing it, that you can just come in and get the support that you need to help reach breastfeeding goals. And you can look on our website as well, prairielakes.com, and we have links to understanding benefits, challenges, and some of the basics of breastfeeding that you can get some support there as well.
Not all moms breastfeed, Sarah. What are the advantages of it, or what maybe are some of the disadvantages of it?
We highly encourage breastfeeding because it is part of the World Health Organization to exclusively breastfeed for the first 6 months and then continue with supplementary foods up to the first 2 years or beyond. And that's just to reduce the risk of other health issues and concerns. So breastfeeding has benefits for both moms and babies. Breastfeeding can reduce the risk of certain cancers. It can reduce the risk of obesity and diabetes. The list just goes on. And like I said, that's for both mom and baby. And so even your risk for sudden infant death syndrome, that's something that we all hear about. You decrease your risk of that by 50% when you're breastfeeding. So that's an amazing health benefit for baby, especially.
Who should attend these sessions, Sarah?
If you're expecting mom, wanting to learn some more information about breastfeeding, you're curious to see how it goes. If you're an experienced mom and want to help support other new moms and trying to figure things out, and new moms who are struggling or succeeding, we want all walks of this journey to be present.
Is there any cost associated with it?
None at all. Absolutely free.
Okay. What else do we need to touch on or know about the Baby Cafe that we haven't talked about up to now, Sarah?
I'd just like you to know that it's every Tuesday, 10 o'clock to 1 o'clock in the maternal child health or labor and delivery waiting area.
Every Tuesday from 10 to 1, and again, free of charge. Where do we go online, Sarah, to get more information?
www.prairielakes.com.
All right. Now, you've been in your job for a long time. What do you like about the work that you do?
Oh, I love every aspect, I guess. I get to do the education, like I said, so I'm also in childbirth classes and teaching moms prenatally, preparing for things, and then I get to see that some of them when they come up to have their baby as well. So then I've already had a little bit of rapport, been able to connect. And then also with helping with the lactation support, I can oftentimes see them again afterwards when I do rounds while they're here during their stay, or I do follow-up calls to see how things are going at home. So it's very beneficial. It's rewarding for me just to see all aspects of that come around.
Sarah, is there any information or research out there that talks about at what age for the baby should a mom start breastfeeding and at what age they might want to transition from breastfeeding maybe to bottle feeding? Is there anything out there on that?
Yeah, absolutely. It's beneficial to start right away. Our body produces colostrum, that's the first food, and that is designed specifically for the newborn. So that lasts for the first few days. It's very high in immunities, antibodies, trying to keep the baby healthy, and has the exact amount ratio of proteins and carbohydrates and fats and everything to help baby to transition outside of the uterus. And then the recommendation is to be exclusively breastfeeding for the first 6 months of life, and that's because at 6 months is typically when you start introducing solid foods. So then you still can continue breastfeeding on. Like I said, 2 years or beyond is what is recommended by the World Health Organization, just for the most benefits. But any amount is encouraged, obviously, as much as you're capable of doing. We know every mom-baby diet is different, and definitely want to help support through all those if those are your goals.
Good information, Sarah. Good luck with the program.
Thank you so much. We appreciate it.